Well, I've often shared how much I love to study leadership. John Maxwell's my favorite leadership author, and he says everything rises and falls on leadership. Eugene Woods soon takes over as CEO of Carolina's healthcare system. The organization saw tremendous growth under retiring CEO Michael Tarwater. Carolina Impact's Danielle Koser shares just some of Tarwater's accomplishments.
With the right conditions, a single acorn sprouts into a seedling. Slowly but surely, the seedling grows into a mighty oak tree. In similar fashion, Carolina's healthcare system has humble beginnings. Opening 75 years ago as Charlotte Memorial Hospital and extending its reach to include more than 900 care locations across 2 states and nearly 40 hospitals.
We are very blessed that the healthcare industry is such a driver of Charlotte's economy.
Over the years, the organization weathered obstacles, like overcoming its reputation as a second-rate hospital and later earning national recognition as one of U.S. News and World Report's top hospitals.
And it really is about population health and how we can take care of individuals as well as communities.
Now the system prepares for another season of change as CEO Michael Tarwater announces his plans to retire after 35 years with the organization.
He's built a great team, a wonderful leadership team, and it permeates throughout the organization.
Tarwater joined Carolina's Healthcare in 1981, working on the administrative staff of former CEO Harry Nurkin.
Harry was a great leader and built so many wonderful things at what is now this Carolina's healthcare system.
Under Nurkin's more than 2 decades of leadership, Charlotte Memorial grew in both profit and size.
That really put the Carolina's healthcare system on the path to excellence, not just in terms of the growth they've seen, but the excellent customer service, the competitive cost structure.
Charlotte Memorial changed its name to Carolina's Medical Center in 1990. 6 years later, the Charlotte-Mecklenburg Hospital Authority rebranded itself, becoming Carolina's healthcare system. Nurkin retired in 2002, passing the torch to Tarwater.
He took that foundation and wasn't satisfied with what it was, but continued to build on it. And I think that's the sign of a really good leader, someone who comes in, who honors the past and takes the good things from the past, operates in the present, but plans for the future.
Ever since I've met him, it's all about the patients who we take care of, making sure we stay true to what CHS has been from its inception.
Under Tarwater's direction, Carolina's healthcare grew from about 6,000 employees to more than 60,000, becoming Mecklenburg County's largest employer and one of the nation's largest public healthcare systems.
He wouldn't consider himself a powerful leader, but the evidence of his presence here, his legacy, if you will, there's some physical parts of that, the Levine Children's Hospital, the Levine Cancer Institute, and so much more around just the physical presence of Carolina's healthcare system.
Tarwater also leaves his mark on the community. As chair of the Charlotte Chamber in 2014, he introduced the theme Healthy Charlotte.
That theme allowed us to promote and educate folks on the role that healthcare plays in our economy. We need a healthy economy, a healthy transportation network, healthy schools, a healthy workforce. And today we have the Healthy Charlotte Council that lives on as a result of the year of his leadership.
Working to lead the transformation of healthcare, a complex and rapidly changing industry, Tarwater developed a strategic plan to increase access to care in rural communities.
It's not been, we're Charlotte, come to us. It really is, we're Charlotte, we have a lot to offer. Let's go to you. Let's help you serve your patients where they are.
And an emphasis on patient care is reflected in the organization's logo, the Tree of Life, with branches representing gentleness, justice, generosity, humility, prudence, wisdom, kindness, loyalty, and courage.
When he talks about the patients or he talks about the patient interactions, that's really when you'll see his true heart. He really cares about individuals, he really cares about patients, and he really cares about what our organization stands for.
To see that the compassion and the care, the real passion for caring for people, regardless of who that person is, where that person is, but the passion for doing the right thing and caring for that person, that begins at the top.
Like a strong oak with deep roots in the community, Carolina's healthcare system prepares for a new season, growing its future on the foundation Tarwater leaves behind. For Carolina Impact, I'm Danielle Koser reporting.
Thanks so much, Jenny.